Our next speaker is actually from Unison this time. It's Ian Mullen. Ian?
Thanks, Robin. Apologies for couldn't get myself unmuted. Yeah, I can't dispute anything that Nick and Graham have said going before me. I've actually been in this council as an employee for 37 years now, and I've been a trade union rep for 25 of the years. And I can never remember a time where the trade unions, the staff, or in this case, the service users, have ever been treated so disgracefully. The decision that the IJB took to close these 5 care homes was taken completely unilaterally, without any consultation with staff, with the service users who are fundamentally the most important people affected in this move, in this decision to close, and also their families. The closure of these homes is effectively closing our clients' own personal home. This is where they live. This is where they build up relationships with staff and with other people that they live with. And there's been absolutely no thought, in my opinion, by the IJB given to that. I actually found out about the closures when I was at a branch meeting with fellow reps from Unison, and they turned around and one of our senior branch officers came in and announced that it had just been announced that there was 5 homes up potentially to shut. And of course, we immediately started our online petition, which, if anybody hasn't signed it, I would encourage you to sign it. It's on the Edinburgh Unison website. I think at the moment it's been up and running for about 3 weeks now, and we've got 200 signatures on it. Our branch officers and our, which I'm one of, and our full-time officials are now visiting or have visited all the impacted care homes. We spoke to the staff who are just, their morale is at an all-time low. It's just, you cannot express how disappointed our staff are in being treated that way. A lot of whom have actually worked through this pandemic. They've stayed away from their own families and their loved ones to make sure that they don't take any chance of infection into the homes and into their clients and into, to their colleagues as well. So there has been a lot of professional commitment that's been shown by mainly our low-paid, some of the lowest paid workers that we have in this council. That should be remembered as well. With regards to the care inspectorate, allegedly the council's decision was based on the care inspectorate saying that these buildings weren't fit for purpose. I've actually been in Ferrylee on several occasions. I've never seen any of the managers, our staff, any of the service users ever complaining about the quality of accommodation or the building itself. But what I was saying to Nick earlier is that if there is a recommendation for the care inspectorate that these buildings are not fit for purpose, then rather than selling them, and some of them are in prime areas, and I think there's a fundamental decision that the IJB's taken to save money by selling off to the private developers. What would have been more financially feasible would have been to redesign or redevelop the existing buildings that are there, and to keep as many of the service users as possible in the buildings while they were done, or just temporarily move them, knowing that they would be going back to their home, their own homes, and to people that they live out with just now, or that help out, that work in the homes themselves. It was interesting that Liberton Hospital came up, because that plot of land has been up for sale for several years now. Initially, it was going to private development, and then all of a sudden, the council have acquired it for social housing, and they've said that they would move the patients from Liberton Hospital to Drumbray. Now, I find that rather strange, bearing in mind that the council are saying on one hand that Drumbray isn't fit for purpose, and yet they can take patients out of the hospital and put them in, and they can't keep the clients in Drumbray that they have at the moment. So it's a bit of a strange concept for me. That if we also look at throughout the whole of Edinburgh, we've got 65 care homes. 56 of them are owned by the private sector, and are owned by millionaires and multinational companies. We have, and Nick's absolutely right, what we're basically doing is we're putting money into the private sector, and we're making millionaires out of many, many people who are more concerned about their shareholders than the level of care that they give to our elderly. And that's why, and one of the other reasons that our care profession staff are so badly paid. And there's high turnovers, as Nick said as well. My personal point of view, every care home in Scotland should be brought under public ownership. The care inspectorate reports that have been sent on a regular basis to the Scottish Parliament, which I have read most of, if not all, have found that the vast majority of private care homes during the pandemic have been poorly run. And they've continually had to go back and reassess them. And it has found that the publicly owned, the council owned care homes have been more accountable. Just the other thing I think that we have to think about in bringing care homes into the public sector is that without doubt our staff aren't recognised for the professionals that they are. And it's about time that they did get recognised as professionals and that they were paid accordingly. I want to end tonight by, I was saying to Peter earlier before we started that Unison has literally just sent me a newsletter just before I came into the meeting. And if you don't mind, I'll take a minute just to read that. And it says, we are campaigning for Edinburgh Health and Social Care Partnership and IGIB are considering the closure of 5 council care homes and changing the remaining 3 to nursing homes with the addition of nurses. This will end the council provision of residential care in Edinburgh, leaving it completely in the hands of the private and third sector. This decision leaves residents and staff in existing homes facing heartbreaking disruption. So we promise to resist the closure as no replacement homes were proposed. Here is what we are calling for. This is what the City Edinburgh Council Unison branch are calling for. A replacement 60-bed council care home following the closure of Drumbray Care Home and its transfer to the NHS. If the council are paying the NHS £16 million for Liberton Hospital grounds, Unison are calling for a replacement for Drumbray. If Drumbray has to transfer to the NHS for urgent clinical reasons, the low number of staff and residents should be accommodated until the replacement unit is built. Second point is 15 million earmarked for a replacement 60-bed care home that was deleted from the council budget as a saving in February this year should be reinstated. This facility is essential to the future of care in Edinburgh, as presumably a replacement for the smaller care homes now facing closure. The current plan to expand the care home services to help people stay in their homes longer appears just to be the expansion of the 15-minute visits by private providers in the third sector. This is completely unacceptable. The people of Edinburgh and all social care workers deserve better treatment and better funding than that. Ending the provision of council care homes in Edinburgh and replacing it with 15-minute home visits should be a political dilemma, especially with the council elections next year. Unison calls on the Scottish Government and all political parties to call a halt to these ramshackle proposals and prepare a comprehensive plan we can all support. The way the staff have been treated in this process has been horrendous. After working through this pandemic, caring for the most vulnerable under constant scrutiny and at considerable risk to their own and family safety. This is their reward. We are calling for these replacement homes to be built to house the staff and residents. They deserve nothing less, and I'll just finish with this. There are proposals to have a 12-week public consultation on the future provision of care in Edinburgh, which would take us up to the end of this year. We are sure you will join with us in campaigning to have the right outcome for the residents, the staff, a better funded care system, and support people in council-run care homes and provide a quality of life if they choose to stay at home, which we currently can't afford to provide. The alternative is a privately run care home monopoly and underfunded and overstretched care at home provision. I'll finish at that. Thanks.